Our first speaker is Dr. Brian Feldman, professor of pediatrics and medicine at and a senior scientist and head of the Division of Rheumatology at Hospital for Sick Children. And it's the University of Toronto, Ontario, Canada. And he's going to speak this morning on self-management, transitional care in adolescents with JIA. As adult rheumatologists, many of us get these patients in transfer, and he's going to discuss all that.
Well, thanks, David, and thanks all of you for coming so early in the morning to hear this lecture. I just wouldn't mind a show of hands here. Who here is an adult-based rheumatologist or internist? And how many of you take patients in transfer, children with arthritis, when they turn 18 or 20 and they're transferred to your practice? So that's what I'm going to be talking about today. So hopefully that we'll have some things in common to discuss. Now, what I'm going to do today, this is kind of like a map of my talk. What I'm going to do is present to you 4 cases and illustrate with them what I think are some of the important issues in the transition process. The first patient, Michelle, I'm going to use to talk about how childhood arthritis is different, and we'll talk a little bit about the classification of arthritis, a very little bit about its treatment of childhood arthritis. Second case is Courtney, and I'll use her to illustrate some issues of adolescence and transition, and also to focus a little bit about medication adherence, which is a big problem for many of our teenagers. The third case, Ryan, I'm going to use as a springboard to talk about self-management and how we might give self-management to children with arthritis and teenagers. And finally, we'll talk about Mohammed, who I'll use as a way to illustrate transition best practices. Now let's start with Michelle. Michelle is a very kind of typical patient that I see. I first saw her about 16 years ago. She was 2 years old, which is a typical starting age for children with arthritis. And she presented to me in a way that many patients do present. Her folks, attentive parents, had noticed one day in the bathtub that her knee was swollen. She wasn't complaining about pain. They hadn't noticed any limp or stiffness. They just noticed a swollen knee. And they came to see me, and we found a swollen knee and a swollen ankle, made a diagnosis of oligoarticular juvenile arthritis, started her on some NSAIDs, and then booked her for corticosteroid joint injections, and she did very well. But because she has childhood arthritis, and because of the high incidence of asymptomatic uveitis, we did, as we do with all these kids, sent her for regular screening ophthalmology visits. And on one of these visits, when she was just a little bit older, they found that she had fairly active anterior uveitis and already had some scarring changes from that. And so her ophthalmologist, who happens to be in Toronto one of our best uveitis specialists, started her on some topical therapy, and that wasn't really enough. So he asked me to start her on methotrexate, which I did, and there was some resolution in her uveitis, but as things went on, she was one of my first patients who went on infliximab for uveitis, because this was a number of years ago. He said, we need to do something else. We started on infliximab. It settled down the uveitis beautifully, and she's been on that cocktail ever since. Now, not surprising, a child with oligoarticular arthritis on methotrexate and infliximab, her arthritis completely disappeared. She hasn't had arthritis since those early days. But she has continuing grumbling uveitis, and so she sees her ophthalmologist regularly. If he needs to change the methotrexate or the infliximab, he calls me up. I meet the parents, we change the dose, and I only see her about every 6 months or so to monitor toxicity, monitor her blood work, and things like that. Then she turned 17, and I started the transition process. And I sent her to one of our, one of the rheumatologists that I often send transition my JIA patients to. I won't say her name because many of you might know her. I sent her, and she had a visit with this rheumatologist who called me up and said, I can't deal with this. Said, I know how to deal with arthritis. She doesn't have arthritis anymore. Says, I'm not going to work with the ophthalmologist to adjust her medications. I'm not an ophthalmologist. I don't know anything about uveitis. And then I was stuck. She said, you got to find someone else. I said, well, how am I going to do this transition? So I'm just using this